California's mask mandate in schools comes as cases of coronavirus are spiking among children. We're going to talk about that with some 72,000 kids testing positive last week.
Yeah, Dr. Richard Kang joins us now. He's the director of pediatric intensive care at Dignity Health Northridge Hospital. Welcome, doctor. Thanks for being with us. So there's this debate over masks in schools for kids. Based off of all the science that you've seen, should kids in school, especially kids that haven't been vaccinated, be wearing masks?
I support the wearing of masks in schools, especially for those 12 and under who can't have, under 12 years of age who aren't eligible for any type of vaccine. But even those that are vaccinated, we know that even if you're vaccinated, you can't spread the virus. So I definitely support wearing masks in schools.
So you work in pediatric intensive care. Can you tell us what you're seeing with kids?
So we have seen an uptick in the number of cases, and it's not just us, but around the country, a number of cases in children have been increasing. And I think part of that is with the increase in the number of cases from the Delta variant. So it's not just the adults, but definitely an increase in the number of cases in children. And not only that, it's the percentage. In the past, children represented only about 10% of cases reported, and now they're up to 20% of cases reported weekly.
You know, before we thought that kids wouldn't be hit as hard by the virus. What are you saying?
It's not that they're being hard. I think it's just the sheer numbers have been going up, and we know that the Delta variant is very contagious, more contagious than the original form of the virus, and just with the sheer numbers going up, that's where we're seeing the number of cases in children going up, as well as children are now more out and about, you know, with the easing of restrictions and easing of mask mandates. We saw that just the number of cases are starting to increase, not just in adults, but in children as well.
When we talk about cases, how many of those kids end up hospitalized, dying, really badly sick? Because more people are getting it, yeah, what do we know?
Right, so there's nothing to indicate that the Delta variant is doesn't cause more serious illness in children. So in children, usually it's mild illness, flu-like symptoms, but something that's important to note is that we're approaching the viral respiratory illness season in children. So we are seeing co-infections with other viruses such as RSV, and we're going to start seeing the flu soon. So we don't know what will happen in children who get COVID on top of flu as well. So that's something to consider as well.
All right, doctor, if I'm a parent, I'm sitting here thinking, how does this school year play out? How do you envision things moving forward?
So I think if we can follow the preparation that LAUSD, at least in Los Angeles County, that we should practice mask wearing, social distancing. Obviously, as many of the students that are 12 and over that get vaccinated, they'll add an extra layer of protection as well. But I think you know, as the school session starts, we'll see what happens in the number of cases in children as well.
And what is the latest information that we know in terms of when a vaccine for kids under 12 may be available?
So, you know, the data, Pfizer and Moderna, I know have submitted their data. The FDA has to examine that data. So we don't expect probably them to be at least approved for emergency use till maybe in the winter time.
All right, Dr. Richard Kang, we continue to watch how the developments are happening here with the coronavirus. Thank you for your time.
All right, thank you for having me.